2. Understanding pulmonary arterial hypertension, PAH. Pulmonary arterial hypertension, or PAH, is a serious condition that causes high blood pressure in the arteries of your lungs. Although PAH is considered a rare disease, it can affect anyone, regardless of age or ethnic background. There are different causes of PAH, and nearly half of people with PAH develop it from an unknown cause. Some may have inherited their PAH, while in others it may be associated with other conditions, such as certain forms of heart disease, connective tissue disease, or HIV infections. PAH can involve changes in the levels of 3 substances that occur naturally in your body. Over time, these changes can cause the arteries in your lungs to become thick and stiff. As this happens, the arteries of your lungs may tighten or narrow and scar, making it more difficult for blood to flow. When blood flow is restricted, your heart must work harder to pump blood through the arteries of your lungs. This can cause the muscles in your heart to thicken, which can make it more difficult for your heart to pump blood. As time goes on, the strain on your heart can progressively worsen. Arteries in the lungs may be affected when there is either too much or too little of the 3 naturally occurring substances in your body. But there are medications available that can target each of these 3 key pathways. The nitric oxide pathway, where phosphodiesterase type 5 or PDE5 inhibitors work. The endothelin pathway, where endothelin receptor antagonists or ERAs work. And the prostacyclin pathway, where prostacyclin analogs, and prostacyclin receptor agonists work. PAH can take a long time to diagnose because symptoms are similar to those of other heart and lung conditions. According to the World Health Organization Functional Assessment Classification, symptoms of PAH can include feeling tired or worn out, chest pain, shortness of breath, limitation of physical activity. Although there is no cure for PAH, there are therapies to help delay its progression. Over time, our healthcare team will monitor your status, and this may include conducting one or more of the following tests. A supervised walk test, which is the measurement of distance walked in a specific amount of time, completed under the supervision of your healthcare provider. Cardiopulmonary exercise testing, which is a test usually done on a treadmill or stationary bicycle to measure breathing capacity during exercise. An echocardiogram, which is a non-invasive test using echoes of ultrasonic waves to take a picture of the walls and internal structures of the heart. An NT-proBNP plasma level blood test. NT-proBNP is a hormone in your blood. Higher levels can mean damage to your heart. And right heart catheterization, which is a test that involves passing a thin tube into the right side of the heart in order to test heart function and measure blood pressure in the arteries of the lungs. Let's dig deeper into PAH and how it may affect your body.
You may have learned a lot about pulmonary arterial hypertension, also known as PAH, but you may be interested in learning more. Understanding how PAH may affect your body can help you ask better questions when talking to your doctor. PAH is high blood pressure in the arteries of your lungs. It's a serious condition that can make it difficult for blood to flow through your lungs. When living with PAH, the small arteries of your lungs can become narrow, thick, and stiff. In other words, think of your arteries like a highway. Ideally, traffic runs smoothly at full speed. But when roadwork narrows the highway, traffic is restricted and fewer cars can go through. Similarly, narrowing of your arteries makes it more difficult for blood to flow and causes the pressure in those arteries to increase. PAH can involve changes in the levels of 3 substances that occur naturally in your body. These substances are nitric oxide, endothelin, and prostacyclin. Each of these substances can affect the arteries in your lungs. If you have PAH, your body may not make enough prostacyclin or nitric oxide. Your body may also make too much endothelin. These changes can lead to the arteries in your lungs becoming thick and stiff, which may raise your pulmonary arterial pressure. As a result, your heart must work harder to pump blood through the arteries of your lungs. Over time, this can cause the muscles of your heart to thicken. This can make it more difficult for your heart to pump blood to your body. As time goes on, this strain can get worse. There are PAH treatments available that target each of the 3 key pathways to help open the arteries, and they may be used together. Certain treatments work on the endothelin pathway. Others work on the nitric oxide pathway. The prostacyclin pathway is one of the 3 pathways. Uptravi, selexipag, is an FDA-approved medicine that targets the prostacyclin pathway and can work with a PDE5I and/or an ERA to help open the arteries. Now that you've learned more about PAH, you can watch the next video to learn about how Uptravi, an FDA-approved treatment that targets the prostacyclin pathway, may help delay PAH progression.
Important safety information. Do not take Uptravi if you take gemfibrozil, because this medicine may affect how Uptravi works and cause side effects. Do not take Uptravi if you are allergic to selexipag or any of the ingredients in Uptravi. Before you take Uptravi, tell your healthcare provider about all your medical conditions, including if you have liver problems, have narrowing of the pulmonary veins in your lungs. This is called pulmonary veno-occlusive disease, PVOD. Are pregnant or plan to become pregnant. It is not known if Uptravi will harm your unborn baby. Are breastfeeding or plan to breastfeed. It is not known if Uptravi passes into your breast milk. You and your doctor should decide if you will take Uptravi or breastfeed. You should not do both. Are taking any other prescription or over-the-counter medicines, vitamins, or herbal supplements. What are the possible side effects of Uptravi? The most common side effects are headache, diarrhea, jaw pain, nausea, muscle pain, vomiting, pain, redness, or swelling at the injection site with Uptravi for injection, pain in arms or legs, temporary reddening of the skin, flushing, joint pain, low red blood cell count, less appetite than usual, rash. Talk to your doctor if you have a side effect that bothers you or does not go away. These are not all the possible side effects of Uptravi. For more information, ask your doctor or pharmacist. You may report side effects to FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Keep Uptravi and all other medicines away from children. What other medicines might interact with Uptravi? Uptravi and other medicines may affect each other, causing side effects. Tell your doctor about all the medicines you are taking. Do not start any new medicine until you check with your doctor. How should I take Uptravi? Uptravi tablets. Take Uptravi exactly as your doctor tells you to take it. Usually, your doctor will have you take Uptravi twice a day. Taking Uptravi with food may help you tolerate Uptravi better. Swallow Uptravi tablets whole. Do not split, crush, or chew tablets. Tell your doctor if you have any form of liver disease. Your doctor may need to change your dose of Uptravi. Uptravi is measured in micrograms, mcg. Tablets come in the following strengths: 200, 400, 600, 800, 1000, 1200, 1400, and 1600 micrograms. Uptravi given by intravenous IV injection. Your healthcare provider will give you Uptravi into your vein through an intravenous IV line. Your healthcare provider will decide how much Uptravi for injection you will receive each day based on your current dose of Uptravi tablets. What is Uptravi? Uptravi, selexipag, is a prescription medicine used to treat pulmonary arterial hypertension, PAH, WHO Group 1, which is high blood pressure in the arteries of your lungs. Uptravi can help delay, slow down, the progression of your disease and lower your risk of being hospitalized for PAH. It is not known if Uptravi is safe and effective in children. Please see full prescribing information and patient product information